Edwardsiellosis, emphysematous putrefactive disease of catfish. Edwardsiellosis, a disease that are caused by gram-negative rods bacteria, Edwardsiella species. Edwardsiella tarda are species that are transmissible to human. Meanwhile, for Edwardsiella ictaluri are the one that can cause manifestation of enteric septicemia disease of catfish or ESC. Edwardsiella species can affect various range of freshwater and marine fish, including Oreochromis niloticus, Pangasius hypothalmus, and eels. Edwardsiella species as Edwardsiella tarda can be found across the globe in various climate conditions, including cold, temperate, and tropical. However, for Edwardsiella ictaluri, it geographically distributed in temperate and tropical region, particularly Mississippi area at the Western Hemisphere, Florida, and Vietnam. In Edwardsiellosis, mortality in the fish farm can increase up to 50%. Fish that affected by Edwardsiella will show signs of spiraling movement and die with mouth agape and opercula flared. In cases of mild infections, the only clinical signs is small ulcerative cutaneous lesions located on the posterolateral parts of the body. As the disease progresses, abscesses develop within the muscles of the flanks or caudal peduncle. These abscesses rapidly increase in size and develop into large cavities filled with gas and, in the acute stage, are visible as convex, swollen areas. In Edwardsiella ictaluri infection, which cause enteric septicemia, hemorrhagic lesion on the skin and abdominal organ can be seen. The transmission of the disease can occur via ingestion of the bacteria through fecal-oral route, cannibalism of infected fish, or direct contact with the infected fish. It is important to know that there are few factors that predisposed fish to Edwardsiellosis, such as poor water quality, high organic load, and high stocking density. For diagnosis, organ samples such as kidney can be taken for bacterial cultivation and identification. Presumptive diagnosis can be made if the bacteria isolated is short, motile, gram-negative rods that are oxidase negative. The isolate also should ferment glucose with both acid that turn the color and gas are produced. The triple sugar iron test also result in alkaline slant with acid but with gas and hydrogen sulfide production. However, for confirmatory diagnosis, it can only be accomplished if the isolate agglutinates in the slide or microtiter agglutination test with Edwardsiella tarda antiserum. Other tests that can be done as confirmatory diagnosis include fluorescent antibody technique and also polymerase chain reaction. For treatment and prevention, a good number of antibiotics can be used to treat the infection, such as norfloxacin, ciprofloxacin, oxytetracycline, gentamicin, and chloramphenicol. However, antibiotic has been used to prevent disease outbreak for a long time, causing the emergence of drug-resistant bacteria in which there are 4 tetracycline-resistant determinant genes that has been reported in Edwardsiella tarda. It is important to avoid indiscriminate use of antibiotic, and the targeted treatment should be done based on antibiotic susceptibility test. High dependency toward antibiotic and indiscriminate usage may result in no effective treatment available in the future. The disease also can be prevented by avoiding existence of stress factors such as overcrowding, malnutrition, sudden change of water, temperature, and pH. Anti-stress such as probiotic and ascorbic acid can also be incorporated in feed as preventive measure. Another method is by ensuring your stocks are free from the pathogen. This can be achieved by screening new stocks from Edwardsiella. Lastly, this disease can be prevented through vaccination. Available vaccine include Bacterin, killed vaccine, and live vaccine. That's all for this video. Hope you guys can enjoy this video. Stay tuned.